Hello, Clinic Review family. It's Dr. Sharon from Clinic Reviews, the best Nclex preparation in the universe, in my opinion. Thank you to all of our channel subscribers. It really means a lot to me that you subscribe to our channel. Not just subscribe, channel members. They're members. I know we have a lot of subscribers. Thank you to you too, but thank you to our channel members. And if you would like to pay me for something, then you can go to clinicreviews.com and sign up for one of my next gen small group tutorings that I do. That does cost money. Go to clinicreviews.com, not the YouTube channel. And let's see, you can sign up for tutoring with Mark, or you can get the online on-demand Clinic Review. So that is what you can do. Today we are doing first aid, and I'm calling it first aid. If you were to look it up in your nursing textbook, it would call it environmental trauma or environmental problems, but it's things that can happen out in the community. And we would kind of more colloquially call it first aid. There's a lot I could talk about. There's going to be a lot I'm not going to talk about here because there's a ton of things I could talk about. But I think that what you are going to get here are questions you could get on the Nclex. I try to focus on topics that you could get on Nclex that are pretty fundamental, but that you might have forgotten about. You probably learned it at some time, and then you just forgot about it because you didn't see it. And especially since we do clinical in the hospital as nurses, a lot of times we forget about a lot of the community issues, the first aid issues that we might have to address. So let's go ahead and get started. The elementary school nurse is teaching children how to prevent injuries from cold exposure in the winter. Which student's statement demonstrates that the teaching has been effective? Dressing in layers is important. I will drink lots of water when I exercise. Taking frequent breaks will help me rest. Wearing 3 pairs of socks is very important. Okay, so this is a question where it seems really easy, and it's not that hard, but you read the answers and you go, wait a minute, all of these answers are true, and they are all true. All the answers are true. And so you can get confused as to what you're really looking for. Like you might say, wait a minute, it's real. The most important thing here is to drink lots of water when I exercise. And if I were to say, what is the most important concept here? I probably would agree with you that B in a big idea, as a big idea, is probably the most important concept here. The problem is B does not relate to the question. So that's why I always read the question, read the answers, and read the question again, because it helps me refocus on what I'm actually being tested on. The elementary school nurse is teaching children how to prevent injuries from cold exposure in the winter. All right, so this is related to cold exposure. So dressing in layers is important to prevent cold exposure or prevent injuries from cold exposure. That's a true statement. I will drink lots of water when I exercise will help prevent injuries from cold exposure. That's false. So I'm crossing off B. Taking frequent breaks will help me rest, will help prevent injuries from cold exposure. That's false. So I'm crossing off C. Wearing 3 pairs of cotton socks is very important. Well, I don't know if it's very important. So I don't love the word very because that's sort of an extreme word. Nevertheless, D, wearing couple pairs of socks will definitely help prevent injuries from cold exposure. That's absolutely true. So I say, well, A and D both help prevent cold exposure. How am I supposed to pick which one is best? And I've talked about this in other videos. I'm going to keep talking about it as we get questions that are like this, but you use the umbrella principle here. The umbrella principle is a big idea, and then smaller concepts fit under that. So I always use the example, vital signs is the big idea. Heart rate, blood pressure, respiratory rate, and temperature are the smaller ideas under the big umbrella idea of vital signs. So that's what I mean by an umbrella principle. So the question is one of these, A or D, the umbrella principle, and is one of them the smaller principle underneath it? So dressing in layers is important is a true statement. Wearing 3 pairs of cotton socks is very important. That's true, but that's only dressing in layers for the feet. So A is the bigger umbrella principle. That's talking about multiple layers so you can put on, take off as you need to, depending on if you get cold or hot. Whereas D is only related to wearing multiple layers on the feet. So the big idea principle, the umbrella principle is A. Even though D is true, the umbrella principle is A, and it encompasses D within it. Okay. All right. Two, the nurse is providing reminders to a Red Cross class about safety procedures to prevent drowning. In which situation does this present the greatest risk? That's some strange wording, but okay, we're worried about safety procedures to prevent drowning. Who's at greatest risk for drowning? A couple goes swimming together at a local lake, children swimming at a community pool, college students going to a party at a boathouse, families going to the quarry to swim. All right, so we're talking about safety procedures to prevent drowning. Which situation prevents the greatest risk? All right, couple going swimming together at a local lake. That doesn't seem like a really high risk, but a local lake probably doesn't have a lifeguard. So I'm going to keep A on the list. B, children swimming at the community pool. So the children seems like a risk, but a community pool would have a lifeguard. So I'm going to cross off B because they have a lifeguard. College students going to a party at a boathouse. Okay, so there's no lifeguard there. And college students going to a party, I have to think they might be ingesting substances that could cause some intoxication there. So that seems like a pretty high risk going to a party at a boathouse. And don't say, well, how do we know they're swimming at the boathouse? You can, because of the way the question is worded, you can assume they're swimming at every single one of these. Okay. Every single one of these, there's swimming opportunity. Families going to the quarry to swim. So I don't think there's a lifeguard there. And families, I don't know if there's small children or not, but there are parents supervising. I'm going to assume there's parents supervising. So we have 3 without a lifeguard. So A, C, and D is without a lifeguard. The couple going swimming at a local lake, they're both adults. I'm going to cross them off because D has children, but the children have parents supervising them. Whereas college students, they're adults, but they could be intoxicated. So I think what they're testing here is, do we know what some of the risk factors for drowning are? And I would think some of the risk factors for drowning are not having a lifeguard, probably age, and intoxication. I would think those are 3 big ones. So I would have to say, I think intoxication is probably a bigger one than probably the others. So the correct answer is college students going to a party at a boathouse. So this is an example of using common sense. I do not think any of you memorized what are the risk factors for drowning. I don't think you did. I didn't. I didn't memorize the risk factors for drowning. So this is using common sense. And this is when you get a question like this, you want to actually think through it and use your common sense and think, what is it testing me on? It's testing me. Do I know what risk factors are for drowning? And use your common sense. What are risk factors for drowning? And then figure out who has the biggest risk. Okay. So that would be how I'd answer that question. 3, which client is at greatest risk for heat exhaustion? Heat exhaustion. A 24-year-old construction worker, a 34-year-old police officer, a 42-year-old swimming instructor, or a 78-year-old gardener. All right, I'm going to cross off C because I think if they're by something they can swim in, they're not going to be at risk for that. A police officer, heat exhaustion, I don't, to me, that's reading a lot into it if I choose them, because a police officer, I don't know that they're even out in the heat. To me, I just don't know that. Now, to me, I see a 24 construction worker because generally speaking, construction is done during the warmer seasons. If you're in the north of the United States or all year round in the south, but it's hot pretty much all year round in the South United States. So I would think A would be a risk and D would be a risk because they're a gardener and you only garden in the warmer seasons. So the question is, would it be more likely for a young person, a 24-year-old, to suffer from heat exhaustion, or an older adult, a 78-year-old, to suffer from heat exhaustion? And I think it's pretty clear that a 78-year-old would be more likely to suffer from heat exhaustion than a 24-year-old would. And that's because as you age, you secrete much less. Your sweat glands are not as productive. I don't know. You don't sweat nearly as much as you get older as you do when you're younger. So that's the reason I'm choosing the 78-year-old. All right. A high school athlete recently suffered heat exhaustion. Okay, a high school athlete. The school nurse is instructing the student on how to prevent a recurrence of this situation. Which student statement demonstrates that the nurse's teaching has been effective? All right, so I don't know how many of you have watched cross country races or football games, particularly cross country races and track meets, like especially the longer races and track. I mean, they can, they're puking their guts up at the end. If they run too far, I've seen it happen. My kids both ran track and cross country, and they have these kids puking their guts up at the end because they're overheated. So this seems like pretty common to me. So let's keep going. I should try to exercise between noon and 3 p.m. Okay, I can't pass that by without saying something. Noon to 3 p.m. is the hottest part of the day. So I can't imagine that's the right answer. I will limit my fluids to drinking sports drinks after I exercise. I don't like it, but maybe. I don't really like to limit fluids, but okay, maybe. Taking frequent rest is important when in a hot environment. Now, that seems like a pretty true statement. Wearing dark colored clothing to deflect the sun away from me will help me stay cooler. Okay, dark colored clothing does not deflect sun. White, lighter colored clothing deflects sun. You should wear light colored clothing. So I got to cross off A and I got to cross off D. So if I want to prevent the recurrence of heat exhaustion, well, I want them to say I will limit my fluids to drinking sports drink after I exercise, or taking frequent rest is important when in a hot environment. So I don't really want them to limit their fluids to only sports drinks. I mean, they can drink water. They don't want to only drink water if they're sweating a lot. Now, if they're not sweating a lot, you don't need to drink sports drinks. But if they're sweating a lot, they do need to drink at least some sports drinks, but that's not all they need. They can drink water. That's not a problem. They do need to take frequent rests when in a hot environment. So C is the more generally true statement. And with questions like this, where it's like, I didn't memorize this, right? I didn't memorize this answer. I didn't, who memorizes this? So I like the bigger ideas. And it seems to me like C is a bigger idea, whereas A is very specific, B is very specific, and D is very specific. So those are also some things I think about. 5, a client presents to a clinic stating, I got bit by something cleaning out the shed. Yikes. That's not good. On assessment, the nurse notices a bite mark with a bluish purple center on the client's posterior calf. What treatment would the nurse anticipate as first line care? Application of ice, elevation of the extremity, initiation of transfer to the trauma center, or localized wound care. So they got bit by something. They don't know what it was, and it shows a bluish purple center. However, they came to the clinic of their own accord, which means they're walking and talking and breathing. They didn't tell me it was really swollen. They didn't tell me it was really painful. They just show me a bluish purple center on the client's posterior calf, and they're walking around breathing fine. I mean, I'm going to assume they're breathing fine because they're talking and they brought themselves to the clinic. It didn't tell me it was swollen, so I don't know that I necessarily need to apply ice. Again, it's not swollen. I don't know why I would elevate it. They don't need to go to the trauma. I can't imagine they need to go to the trauma center yet, but we're looking at first line, so definitely not yet. Localized wound care. All right. Localized wound care can include applying ice. So what do you do for wound care? Well, you clean it. You may dress it. You may apply ice to it. You may elevate it if it's swollen. So D is actually the umbrella answer over A and B. C, I'm saying, is not first line. So I'm crossing off C, but D can actually umbrella over A and B because those could be considered localized wound care. So, and even though I don't know they need to be done, localized wound care is a very big idea. So I'm going to pick localized wound care. So what you don't do here, what's really super tempting is to read into this and go, maybe they need to go to the trauma center. Maybe it was a snake bite. Maybe it was this tick that was carrying some deadly disease. Okay, that's what you cannot do, particularly for my international students who may have grown up in environments where you had some pretty deadly bites that you could get. You're not in those environments. The Nclex is not testing on those environments. If they're testing on those environments with deadly animal bites, they're going to tell you that. They'll be very specific about that. So in this case, based on the information that we have, we cannot read into it. Okay, that would be super tempting. And this is when people say I failed NCLEX and I thought I did okay on it. These are the kind of questions that you probably miss. And so these are not hard questions. What I mean by they're not high level concepts, they're not super complicated. Like reading an EKG is a higher level question, right? This is not a high level question. And I really, really believe that people who fail NCLEX, no matter whether you fail at 85 questions or 150 questions, it doesn't matter. I really believe you fail on fundamental principles. You have to get fundamentals correct in order to pass. And this is pretty fundamental first aid stuff. And if you miss these kinds of questions, it's going to be difficult to pass because you've got to show that you know fundamental stuff. All right, 6. On a hot summer day, an older adult found by a neighbor lying on the floor, agitated and confused. Is found by a neighbor. Okay, hot summer day. After calling 911, the neighbor places ice bags on the client's groin area and armpits. Upon arrival to the hospital, which action does the emergency department nurse perform first? Administer 2 aspirin tablets, check the client's airway, administer high flow oxygen therapy, monitor the client's vital signs, or place a cooling blanket on the client. All right. So this is what I would consider, it's not a trauma in the standard care, but it's like an emergency, right? Emergency trauma. They called 911. They came in the on the squad. And when you have a patient like this, they didn't drive themselves to the ED, they're agitated and confused. And when you have what I would call a trauma or emergency situation, the first thing you always do is airway, breathing, circulation. You always do those first. And this question says, what does the ED nurse perform first? And so I cannot read into this question. I have to go with the principle, which is in an emergency trauma situation, airway breathing is first. So I have to check the client's airway, administer high flow oxygen therapy. Even if you say, but they need a cooling blanket. Yes, but this is a first question, not a best question. This is a first question. And what do you do first? You always do airway, breathing, circulation first in an emergency trauma situation with one person. All right, question 7. A young client comes to the emergency department after being bitten by a scorpion on the playground at school. What action does the nurse perform first? So I don't know who brought them. It doesn't say if the squad brought them or what. Administer a tetanus shot, apply an ice pack to the sting, assess the client's vital signs, or call the poison control center. Okay. They came after being bitten by a scorpion. So this isn't someone who got stung by something unknown in the shed. They did come to the ED. Somebody brought them. It doesn't say they came by squad. Maybe their mom brought them. So they're here. So I'm going to assume that they're breathing and talking because it doesn't tell me they're not. So since they didn't tell me they're not, I'm going to assume that they're breathing and talking. Administer a tetanus shot. And it says, which action do you perform first? So I might have to administer a tetanus shot, but I don't think I'm going to do that first. So I'm going to cross off A. Apply an ice pack to the sting. It says first. I don't think that's what I would do first. I haven't done any other assessment yet. So I'm not going to do that first. Assess the client's vital signs. Okay, I like that. Call the poison control center. I like that. So I'm crossing off A and B. So what would I do first? So here we have a scorpion. We know what they got bitten by. We couldn't call the poison control center for the last patient who got bit by something in their shed while they were cleaning out because we don't know what bit them. Okay. So here we know what bit them. So, and it's a first question. First, the word first is a key word. So do I want to assess the vital signs and then call the poison control center? Or do I call the poison control center and then assess their vital signs? Well, I would rather assess their vital signs before I call the poison control center. I do need to call poison control, but I'd rather know what their vital signs are first, make sure they're stable. They could have walked in, probably if their respiratory might be stable, but maybe their heart rate is fast, or maybe their blood pressure is dropping. Who knows? Maybe their temperature is up. I don't know, but I got to get their vital signs so that I know that before I call poison control, in case I need to stabilize them before I call them. The nurse is teaching a class of park ranger trainees about prioritizing care for clients who have received snake bites. Park ranger trainees, prioritizing care, snake bites. Which ranger's statement demonstrates a need for further teaching? All right. I like it when it says further because it reminds me that I'm picking the false statement. Further, F and further goes with the F and false. All right. Further teaching, false statement. Snake bites. Do not allow the victim to ingest any alcohol or caffeine. All right. That always seems like a true statement to me. It says don't drink alcohol. I'm like, that's a true statement. I think that's a true statement. The extremities should be kept below the level of the heart. Well, that seems true to me. That seems like generally good first aid. Keep the extremity below the level of the heart as long as they're not in shock. The first priority is to call for EMS transport to a trauma center. Maybe. You should first place a tourniquet above the bite. So A and B are general first aid. And so I'm okay with A and B. Those seem like generally true statements. So I got to figure out which one's false. So would it be true? Is it true that I first call the EMS? Is that first? So is that true or not? Or should I first place tourniquet above the bite? All right. So I did this one to teach you this. Never put a tourniquet around the limb for a snake bite. Okay. So that's like an old wives' tale. Okay. An old wives' tale means something that got passed down from generation to generation, but doesn't actually work. So the false statement is put a tourniquet above the bite. So don't do that. At least don't do that on the Nclex. Don't try to suck the venom out with your mouth. Right? That's not a good idea. I've always thought that was so gross anyway. That's like seriously an old wives' tale in the United States that you suck the venom out with your mouth. I don't know if anybody's ever done that, but you don't do that. Okay. Don't let them, and they may go, I'm in a lot of pain. Give me some alcohol. No, you can't have that. And keep it below the level of the heart just so it's not as easily moving to the rest of the body if you got any venom in there. All right, 9. While at a soccer match, a player drops to the ground with heat exhaustion and a diminished level of consciousness. After ensuring the ABCs are intact, what does the team nurse do first? Give salt tablets, move the player to the shade, place ice packs under the arms, provide a cool electrolyte fluid drink. Well, it seems like they're all decent things to do. Soccer match, drops to the ground with heat exhaustion and decreased level of consciousness. So after ensuring the ABCs are intact, so they're breathing and all that good stuff. So what do I want to do first? Well, I wouldn't think give salt tablets are first. They have a diminished level of consciousness, so I'm not going to give salt tablets first. So I'm going to cross that off. Move the player to the shade. Well, if I just imagine we're at a soccer match and the person, collapses in heat exhaustion, it seems like it would make sense. The first thing you would do is move them to the shade. That seems reasonable to me. So I'm keeping B on the list. Place ice packs under the arms. Well, I like that as an option. So I'm going to keep that on the list. Provide a cool electrolyte fluid drink. I can't see that being the first thing. They have decreased level of consciousness. I can't see a cool electrolyte fluid drink being the first thing you do. So I'm crossing off A and D. So would I first move them to the shade and then place ice packs under their arm? Or would I place ice packs under their arm and then move them to the shade? Well, it just makes sense to me if I'm using my common sense. And that's what you have to do here, y'all. This is a common sense question. It makes more sense to move them to the shade and then place ice packs under their arms. That's from a common sense perspective, that just makes more sense. So I'm picking B. All right, 10. While on the school playground, a child is stung by a bee, resulting in redness and swelling. The school nurse is nearby when it happens. What does the nurse do first? Gently scrape out the stinger with a credit card, apply an ice pack to the stinger, inject the child with an EpiPen, remove the bee, and save it for identification. Okay. A seems weird. So the child is stung, resulting in redness and swelling, and the school nurse is right there. So A seems weird. Gently scrape out the stinger with a credit card. That seems weird to me. However, I can see getting the stinger out. So could I do it with my fingernail? I could if I put gloves on. Could I do it with something other than a credit card? Yeah. Would I want to clean the credit card first? I would. I mean, it just seems weird, right? But I guess I could do it with like the end of a pen too. If I clean the end of a pen, get the stinger out. I mean, you definitely want to get the stinger out, right? So it's weird, but don't ever rule out an answer just because it's weird. I have had to choose weird answers more than once, and it's right. Okay. So don't rule out an answer just because you think it's weird. So A seems weird, but I'm going to keep it on the list. Apply ice to the stinger. Now, I'm not going to pick this because it says apply ice to the stinger. I don't want the stinger in the patient, in the kid. I don't want the stinger in there. I'm not applying ice to the stinger. I got to get the stinger out. So no, I'm not going to do B first. I'm not even going to pick it because I don't apply it to the stinger. Inject EpiPen. They got redness and swelling. It doesn't say they have shortness of breath or anything. So I'm not doing EpiPen. I don't know they're allergic to this. Remove the B and save it for ID. Remove the B and save it for ID. We don't remove B's and save it for ID. If they got stung by a bee, they got stung by a bee, y'all. It tells me they got stung by a bee. That's all you got to know. So I got to go back to this weird answer of gently scrape out the stinger with a credit card. And I put this on here intentionally because that's the right answer. And I know you're probably going, what? No way. That's not the right answer. It's a weird answer, y'all, but don't rule out answers just because they're weird. Read the answer and see if it's possible. So what this is what you have to do first is get the stinger out, right? That's the first thing. And it's what does the nurse do first? So the first thing is you have to get the stinger out. So you look for the answer that shows that you know that first you have to get the stinger out. And if it's weird answer like get it out with a credit card, you still pick it. Don't get bogged down in words that you think are weird. What they're saying is use something available to you to get the stinger out. That's what they're saying here. So you'll just have to think about whether you agree with me on that or not. And we'll do first aid again later in another video at some point because there's certainly a lot more we could do. I hope this helps. Good luck on your Nclex. Have a great rest of your day. Bye.